My name is Saul Kay. I'm a pharmacist and the founder of the KETAVERSE. The KETAVERSE is a fully vertically integrated ketamine company that is here to unlock the potential of ketamine as one of the most potential drug technologies that I've been involved in the last 30 years. I'm a retail pharmacist. I'm an online pharmacist. I've been in the pharmaceutical world for the last 30 years here in Israel, and I've been involved heavily in the cannabis legalization movement and medicalization in Israel, and fought in the Knesset lobby to allow patient access to legal cannabis. I own 3 cannabis pharmacies and have been active in the cannabis patient scene for a very long time. In addition, I got involved in the psychedelic industry about 6 years ago with 2 successful exits in psychedelic education companies, and believed in the power of these mind-altering substances that can bring about rapid change in people's lives. And unfortunately, since October 7th in Israel, we are facing a wave of trauma patients that are now becoming PTSD. At the beginning of the war, the health ministry did not recognize acute trauma as a treatment that's eligible for any psychedelic assisted therapy. And at the same time, there are thousands, if not hundreds of thousands of people who need this in a system that is failing them. And so I've established the KETAVERSE as a vertically integrated ketamine company that will deliver ketamine assisted psychotherapy to those in need for suicide, PTSD, pain, and depression. It is a registered medication in Israel, and there is a legal pathway to get therapy into the hands of those that need it today. There is still a lot of stigma around ketamine as a therapy because it is mind-altering, and that needs to break through a barrier that people know that this is a legal, safe medication. Ketamine was discovered in the early 60s as an anesthetic used for sedation, and then in the Vietnam War, we discovered that it was one of the best things to use for puncture wounds, and EMTs in Israel and around the world carry ketamine as a rapid relief for people in extreme pain and in trauma. It's used as ketamine-assisted psychotherapy, a system set up by Dr. Phil Wolfson in the USA. And we brought Dr. Wolfson and Dr. Mark Bronstein out to Israel 3 years ago to train the first doctors and therapists in ketamine-assisted psychotherapy in Israel. And resulting from that, clinics have opened up and patients have been able to receive ketamine-assisted therapy. However, it remains out of pocket and patients can't afford this therapy. It is not covered by the HMOs in Israel, and often these patients are being failed by a system that's unable to deliver both the therapy and who funds that therapy. And so the KETAVERSE involves many aspects that cover the vertical integration of a ketamine company that fully understands the power of ketamine as a drug technology and is looking to protect that technology into the future as one of the most important things that I can do as a pharmacist and as someone living in Israel feeling impotent for the last 2 years. And what can I do with this wave of trauma that is coming and it's touching me in my most personal level in my life of people that are coming in that need help but can't afford it. And so the KETAVERSE is the answer to that. So the KETAVERSE operates 4 operating arms and in the future potentially more. And it is structured as a DAO, a distributed autonomous organization on the blockchain. Think of it like a B Corp in America, the same way that MAPS is established as a B Corp, with a not-for-profit entity at the top with for-profit arms. The for-profit arms include ketamine clinics in Israel, treating suicidality and PTSD. We have training for doctors and therapists so that we can meet the patient demand of trauma that currently exists in Israel. We are developing a program called Ketamine-Assisted Suicide Intervention. And ketamine has been proven in many studies, particularly one in France, that showed 64% rapid relief from suicide ideation for anywhere between 3 days, 3 months, and a year. And then we will be developing the KetaPen itself, which is a self-injecting ketamine dose delivered by EMTs. The EMTs will be trained through the training company, and this is in collaboration with large organizations like MADA and Hatzalah to deliver rapid relief directly to the patients in need, in suicide. If we can deliver that rapid relief from suicide and prevent suicide, that is a mission I want to do. Why am I building this as a DAO? A DAO is a modern instrument that allows investors to invest in this company and participants to participate in the data that we're collecting within the clinics and across the drug delivery. And we want to protect it for future generations. And so we've used the instrument called the DAO, a distributed autonomous organization, that is layered underneath our חברה ללא מטרת רווח, which is our B Corp in Israel, set up in order that we have a non-for-profit managing the intellectual property generated from these ketamine treatments and the drug development, alongside the program to train EMTs in ketamine-assisted suicide intervention called CASI, and help patients directly through the clinics today in our 6-bed facility in Israel. In addition, we have started a give back campaign. It's like GoFundMe. It's a way to get soldiers help that they need right now and unable to afford it in a system that is chronically failing under the pressure of PTSD. We're offering treatments directly to soldiers for free with a legal and safe therapeutic, all licensed by the Ministry of Health in Israel. We are forward thinking as the KETAVERSE, because ketamine is a futuristic drug. It is a synthesized drug. It is not natural. We are looking to the future in how to protect this medicine into the future. We will be educating the regulators, educating the key players in the industry in Israel, the hospitals, the doctors, the therapists, the nurses, the EMTs, and the patients in the availability of this life-changing therapy that is available today. And we're protecting it through the DAO in order to protect this legacy of ketamine into the future. And I feel that's my role as a pharmacist in 30 years in pharmaceutical industry, being involved in people's addiction to pharmaceuticals. We as a society have become addicted to a pharmaceutical system driven by profits. If we have the non-for-profit layer at the top distributed across AI and a DAO, we get to protect that into the future and not become Purdue Pharmaceuticals and what happened with OxyContin. We get to protect this technology, release it in the safest way, protecting people, protecting patients, protecting the drug, because ketamine does have abuse potential. It is now a popular street drug, and many news stories are talking about ketamine being the reason behind, say, famous actors passing away, unfortunately. While ketamine may have been involved, ketamine is not the problem. Ketamine is a life-saving drug, and many drugs that are life-saving are dangerous drugs, but they're able to be given to those that need that therapy most once that information is disseminated out and patients know that they can get it. We have thousands of patients in our pipeline waiting to get therapy. We do not have enough money in the system through the HMOs in order to cover this, and so we're offering patients treatments for free through the GoFundMe program that allows them the honor and the dignity to receive treatment and allows the operators within this space, the room, to have a therapist alongside you, because ketamine-assisted psychotherapy is way more important in my eyes than ketamine alone. Ketamine as a drug is great. We give often medications to patients. They get a prescription, they go to the doctor, they receive even dangerous drugs, restricted medications in a pharmacy, and they take them home and they use them. Ketamine is more effective alongside psychotherapy. There is a neuroplastic window that opens after you take mind-altering drugs like ketamine, and that window within 24 hours allows a therapist, a trained person, entry into pathways in people's brains that allow them to reprogram and reprocess the trauma that they've suffered. And that's how ketamine is able to help long term. But ketamine does also have an addiction profile, and people are becoming addicted to ketamine. In the future, we will also have a ketamine focused rehabilitation program for those that need and have become addicted to ketamine. But the chances are very low for that. So while we protect of it inside the DAO, our main focus is always to get the people the best therapy that we can get them from the best teachers. And I've been very honored to learn from the best of the best in the world who have been doing ketamine-assisted psychotherapy for over 50 years. And we have collaborations with the Ketamine Foundation in the United States, together with the Ketamine Training Center, and our advisors are Dr. Phil Wolfson, one of the most seminal researchers. He's a psychiatrist and a psychotherapist, a Buddhist, and has been doing ketamine therapy with thousands of patients and has trained thousands of therapists and doctors in how to use this awesome technology of ketamine inside a clinical, semi-clinical, non-clinical setting that allows patients rapid relief from PTSD, suicide, pain, and treatment-resistant depression. We can stop suicide now.